Healthcare. Dr. Rose Zacharias is the president of the Ontario Medical Association. She's a doctor. She's been in emergency rooms for 20 years. She joins me right now because I want to put the question to you. As politicians and yourself and other doctors wrestle with this issue of not enough health care, people are starting to talk about privatization, bringing in other resources, and of course opposition politicians are like, you can't do anything except for universality. What's your position? Do we have to somehow branch out into something more than we've had the last 40 years?
So the healthcare that we deliver must be publicly funded. As physicians, we want equal access. We want people in northern, remote, and rural areas to have equal access to doctors, to surgeries, to the procedures that have been backlogged.
But they don't have that now under universality, do they? So clearly universality is not serving that, is it?
So publicly funded healthcare is important.
Oh, yes.
And we have a plan, actually, that addresses the current gaps in the healthcare system that have been massively exposed as a result of COVID. We need more investments around mental health, community, home care, long-term care. We also need to give everyone in Ontario a family doctor to help them navigate the healthcare system and walk alongside their chronic medical conditions so that they can have access equally.
So is it just money then? If the government says, okay, here's another $10 billion, is that the end of it? Is everybody going to be happy then? Or is there something more inherent as to how the healthcare system delivers, as you put it? Everybody should be having access to it. It should be universal. But can we have variations of how it's being served?
So I'll tell you one thing that money doesn't address, and that's the massive amount of burnout that we're experiencing now amongst the healthcare teams. Doctors, nurses, to the tune of 75% of physicians polled last year said they're operating at levels of burnout. There's administrative burdens on doctors. It's taking them away from direct patient care. This has to be addressed.
So that's just not enough nurses and doctors, right? If there were more nurses and doctors, then there wouldn't be the burnout that you're experiencing.
We need more medical student spots. We need less barriers to doctors that have trained outside of Ontario to practice medicine in Ontario.
Yeah,
and we need to, as I said, let doctors be doctors. The administrative burden needs to be lifted off of doctors so they can come away from the computer and be in direct contact with their patients.
How's that going to happen? What are you recommending to the people in the ministry to make that happen? It makes sense.
So some very specific things. Doctors are required right now to fill out a lot of forms, a lot of data entry. They work inside computer systems with drop-down menus and glitchy kind of visual screens. It is cumbersome to work a shift in an emergency department and do direct patient care. That needs to be alleviated immediately.
I hope you get it done. Thank you very much, Dr. Zacharias. 3 minutes. Please stay tuned to keep informed about the latest policy issues. We all need to sharpen our game, because if we don't, we could end up with another Justin Trudeau government, and we don't want that. So please subscribe, tell your friends about the show, and if you can, PayPal, because that guy behind there, he wants to get paid. He does a very good job.